The state of mental health services in South Africa is once again in focus. This after the South African Depression and Anxiety Group raised concern that psychiatric patients at the Charlotte Maxeke Academic Hospital are facing dreadful conditions. To discuss this further, I'm joined by Dr. Mvuyisi Mzukwa, chairperson of the South African Medical Association. Dr. Mzukwa, I appreciate your time this evening. Now, to start off, I'd like to read an excerpt from some research material. And it reads like this, and I paraphrase: they are kept like animals. Psychiatric patients suffer in dismal conditions, and that's at Charlotte Maxeke Hospital. Psychiatric patients being kept at that academic hospital's emergency department in Johannesburg are being kept in unsuitable conditions. Is there a stigma around patients that suffer from mental illness? Is this the reason that they're kept in these conditions?
Good evening to you and to your viewers, and thanks for having me in your program. It is true that there are so many reasons why we find ourselves in that situation, as it was raised by some advocacy groups like the South African Depression and Anxiety Group, who have raised really these concerns, over the country's public mental health institutions and hospitals. And yes, stigma is part of it, but we've got a dire shortage of funding for mental health institutions, but also, we do not believe that it has been taken seriously as in other conditions like the non-communicable diseases and stuff like that. It has not been prioritized. There's a dire shortage of staff. There is a challenge with infrastructure. There's overcrowding. So there's many challenges that are surrounding, this the issue that we're talking about today.
So who's responsible for the deplorable conditions faced by psychiatric patients in public hospitals? I mean, you've obviously talked about the conditions and how deplorable they are, but who's accountable? Whose responsibility is it?
Well, we know that it is responsibility of government to be making sure that mental health care users are taken good care of. Not only them, but also other stakeholders like communities, municipalities as well. But it is important that we note that, there's been a serious challenge. If you recall, there was the Life City tragedy that claimed alive more than 140 patients. And since then, we don't think that, the issue, that was exposed by those significant shortcomings, in our mental health system was really attended to by the relevant authorities in government. The Department of Health specifically is the one that is meant to be taking good care of these patients, making sure that there is enough resources. There is enough wards for these patients. There is enough healthcare professionals. If you recall, in the country now we've got I think just above 700 psychiatrists, and a shortage, of course, of psychologists and stuff like that. So there's many of these issues that are affecting the management of mental health care in the country.
Now, what factors have led to the severe shortage of beds and resources for psychiatric patients in public hospitals? I mean, there seems to be a priority over regular patients over psychiatric patients.
Well, we believe that, mental health conditions have come, to the fore, especially after the COVID-19 period. But we also believe that there must be dedicated mental facilities as it is, but we need more of those, because we can see that those that we have at the moment are overcrowded. But also, like I highlighted earlier on, the other challenge is that we do not seem to be having enough of healthcare professionals, but they're retaining those professionals in those places. Because if you have got poor working conditions, then you cannot retain healthcare workers in that space. So we do need to recognize that we have to improve our working conditions, but also we've got to make sure that we've got enough numbers Because when you've got overcrowded wards and in the facilities, then you are overburdening the current workforce, and that leads to burnout and leads to absenteeism and all these other things that you can mention.
Now let's talk about safety and well-being of both psychiatric patients and hospital staff. How can this be ensured in an environment that seems to lack adequate security and support to manage patient behavior effectively?
Well, the first point about this is to increase, obviously prioritize mental health. By so doing, you will obviously allocate more resources in terms of funding of the healthcare, mental health aspect. Because the problem is overcrowding. So even if you want to attend to those emergencies where you've got mental health illnesses that are regarded as emergencies, it's impossible when you've got overcrowding and when you have got shortages. So you do have to make sure that you've got enough numbers or adequate numbers to attend to this mental health care users. But also the infrastructure, it must be made in such a way that it is suitable for mental health, without stigmatizing those mental health users or patients that are suffering from mental health. So those are issues that needs to be identified. And also security personnel, they need to be trained adequately on how to deal with patients who are suffering from mental health. We've seen recently videos circulating in the media where security guards were assaulting a mental health patient. We think that government has to do more in terms of making sure that people are properly trained to take care of patients in a hospital environment without really causing harm to those patients.
Now, let's talk about the life isidimeni issue in relation to the issues around patients with mental health. And I think the fact that so many individuals lost their lives and the inquest seems to be dragging, if you will, seems to suggest that there is not enough attention that is given to psychiatric patients. And I suppose it also leads to transparency or the lack thereof.
Yes, like I said earlier on, we thought, after the life isidimeni debacle, we would witness, attention or prioritization of mental health. But that's not the case. Like you're seeing now, there are reports already, that mental health care users are just, packed in emergency units, taking space for trauma patients, but also overcrowding, the place. Not because they are a problem themselves, but it is because there is no attention given to the mental health service. Because we are at a risk of repeating history in this case. Because if you look at what the reports that you've just read earlier on, we can see that there are no lessons that have been learned by government to say how do we properly manage mental health care, in a way that is not dehumanizing, is respectful to patients, takes into consideration the rights of patients, when they are admitted, whether they have mental illness or not.
Dr. Mvuyisi Mzukwa, Chairperson of the South African Medical Association, appreciate your time.